Hi there, it's Dr. Porter from Wrinkle Free MD Med Spa and Wellness Clinic here in Austin, and we're here with our mommy makeover winner, Stacy, after a BBL. We also just did some filler on her in her nasolabial fold, so I'll post those photos later. She's been so generous to share with us, but we were going to do her Botox, and one of the areas that Stacy has a lot of concern about is her frontalis, these kind of etched in lines over her forehead. Stacy, how long do you think you've had those?
At least 5 years.
Okay, and you're in your late 30s, correct?
Yes.
Right. So I was all excited to do Stacy's forehead because I'm like, I can fix that, right? And then it's really important to take a step back and look and see, why does Stacy have like deeper lines in her 30s than what somebody else might have? Like, what is the underlying symptom? And was it sun damage? Was it whatever? Well, so I'm looking at Stacy and I'm looking at her eyelids, and she has a little bit of ptosis here of her lids. So make your eyes just go straight. Her lids kind of like look forward. See how her lids kind of hang and they almost touch her eyelashes. So that's called lid ptosis, and they kind of doubled over. And I told Stacy, I said, look, you need a blepharoplasty. And she's like, yeah, my mom had one, my sister had one. It kind of runs in the family. And so when your lids kind of double over like that, generally you have to cut the skin, and you have a board certified oculoplastic surgeon do that, and I'm going to refer her. But here's the problem. So the reason why she has these strong lines is because she's overcompensating for that shadowing that's happening. So raise up your eyebrows for me. See, so she probably walks around with her face like that all the time because she's trying to get that skin to raise so that she's not having obstructed vision. And by doing that, she's created these almost scars in her forehead because she's looking like that. She also said that's her what the heck look for her kids. And she does a little bit of that in her job. And so, you know, life circumstances might make you more expressive in general, but then to compensate for that ptosis. So I guess the point I'm trying to make is sometimes you have to say no, because if we treated her forehead up here today, what might happen is this, right? So relax. So we might push it down even more because this muscle pulls up, as you can see, raise up again for me. That frontalis muscle pulls up. Now, if I relax those muscles, everything's gonna kind of drop down, and then she might be even more droopy. She's not gonna like me. She's gonna like the way her forehead looks, but she's not gonna like the way her eyes look. So what we treated today was make your angry face for me. We treated her angry lines right in here. You can see where she dimples out along her eyebrow, right in here, and we'll relax those. And that's all we did today, that and her crow's feet. So smile for me here. So we treated 12 units on each side along her crow's feet, but we're not gonna do her forehead today. I'm not saying no, that I wouldn't do it, but she might get a little bit of drop just from treating her glabella because this procerus muscle pulls down. So it might pull down a little bit, and then this corrugator pulls this way. So what I didn't want to do is treat this area here and have this happen. She's not gonna like that. She does love her nasolabial folds, and I think she's gonna like her glabellar Botox and her crow's feet Botox. But again, just because you have a line doesn't mean you should treat it. And I think it's important to find somebody who knows what they're doing when they do their Botox, that they don't just chase the money and chase the lines, because sometimes that's, you know, how you end up with a patient who's not happy. And we really strive to have our patients be happy here, and we like to involve them in their care and explain to them why we're recommending something or not recommending it. So anyway, if you want Botox, come on in, or filler, we're happy to help you. Take care.